First thing is to be aware of, listening to your body. There are early warning signs to heart health, So if you do experience things like chest pain or breathlessness or ankle swelling on both legs, things like palpitations, which is that sort of different awareness of your heartbeat, you need to, don't sit in silence, essentially. You need to go and seek health advice go to your GP practice. If you're really unwell, obviously A&E is available as well. So there's lots you can do.
People that have been affected, are they young, strong, healthy people living good lives, or are they people not living the best lives?
I think, again, it's complex.
Oh, is it?
It is
And
complex,
there's a lot of factors, that can interplay between each other. And I think it's a good opportunity to talk about the causes, of heart disease, really. And you've got your obvious ones, like poor diets, not being as active. For me, where I work, I'm sitting down for about 3 or 4 hours seeing patients, and if I didn't have that awareness, I would be fighting a losing battle, I think, with heart issues and health issues in general. We're all sitting down a lot. Other causes are things like, poor diet, alcohol. The list is endless. Genetics plays a part. Ethnicity plays a part too. Smoking, that's the obvious one. But also things that don't give you symptoms and aren't very obvious, like blood pressure, like cholesterol. That's a worrying thing, isn't it? Is because they are silent, they're invisible. And often people go through life not being aware of it. And that's why it's always important to have, going back to what we were talking about, the MOTs, the health checks, to find out if you're one of those people having that invisible
Because Manchester is one of the local authorities with the highest numbers of premature deaths towards to CVDs under 75. And so on the back of that, if somebody gets diagnosed with CVD, because I know when I got diagnosed with cancer, I think at the moment processing it was quite difficult, as you would when you get diagnosed with a health condition like that. And it was having the ability to sort of, if I go back in time, I will tell myself the different, there are different levels of grief. First of all, there is the, I do not accept this. This is not true. There's that part of, being able to be like, I don't want this. But then eventually there's a point when you now accept it, but then you get angry and you're sad and you're down and you're depressed. And then, but there's a level when you accept it and you say, okay, so what am I going to do next? So in a sense, how can somebody process, when they get diagnosed with CVD, with a heart condition, how should they process it, from a doctor's perspective?
I think you made a really good point. Heart disease, again, it's a massive shock, like cancer. It's a shock to an individual. And I think the first point I'd say, it's more of a wake-up call. And it's not a life sentence for a lot of the time. What I would always suggest is looking to support at home, first of all.
Just about to say that,
When my dad had prostate cancer, actually, a few years ago, he was very private about it, but it didn't help him. And it was only until recently he realised that he said he was very scared of getting cancer again. And actually, it's okay to be private about your health, but sometimes it's really helps knowing that someone you love, you care about, has got your back and is there with you every step of the way to those clinic appointments, receiving those letters home. So I think that's the first grounding, that first foundation is people at home. If you can get it, some people sadly don't have that support. And if you don't, often you are interlinked with a consultant, a heart specialist, and you will often get follow-ups. And often people don't or aren't aware that they need to follow up and see the specialist again or the doctor again. So make sure that you are aware if you have that clinic appointment or not. And that's the opportunity. They'll be asking you questions, but that's your time to ask questions as well if there's anything that's on your mind.
Yeah.
Often it's like medications, they're not agreeing with you or you're not sure what they're for. Ask the question. And that just doesn't sit with the consultant as well. Talk to your friendly GP, your practice nurse, your healthcare assistant. So I think at the end of the day, it's about that support. Don't leave it to yourself.
Yeah, I think family's key. When you were speaking then, I was remembering in my years I've dealt with quite a lot of situations where the family has been the key. 'Cause you got to think anything that you go through, your loved ones take every step with you.